Hi, my name is Arnolds, and I'm a senior engineer at Longenesis, and I'm also an alum of this university. Today I'm going to talk to you about a digital consent tool for patient onboarding called Themis. So a little bit about Longenesis first. So who are we? We are a medtech research company based in Riga at Tech Hub, and we are a passionate group of computer scientists, doctors and business professionals who are aiming to make medical research as efficient as possible. So what kind of problems are we actually solving day to day? Well, first of all, it's the data fragmentation. So it's really important in medical sphere to have a complete picture of the patient. And just a little bit of data here, just a little bit of data there is not going to cut it. So another problem is dynamic onboarding of the patients. So we have to give tools to our patients that allow them to control their data on demand. So they can either consent for a study or revoke their consent at any moment they wish. Another problem is compliance with data regulations. As you all know, data regulations are really difficult to understand, confusing, and changing constantly. And that's additional burden on research organizations. Last but not least is the speed of collaboration in the medical sphere. So there are a lot of stakeholders in any medical research endeavor, and there's a lot of papers between them, and that's really slow. So when you just focus on two of the problems, the regulatory compliance and the dynamic consent, you get something like Themis, patient onboarding tool. So it's privacy preserving, so meaning that we do not store any sensitive data on our web servers. It's also patient-centric, meaning that patients actually can onboard or drop out of studies immediately. And it's available for bigger companies with already established patient interfaces, and for smaller researchers who do not have any technical support, so they can also use it as a ready-made product. And the most important part is that it actually allows us to onboard patients, to invite patients dynamically, just like inviting people on Facebook. So how does it actually work? Well, first of all, a researcher gets access to their dashboard and can manage their studies. They can create a new study, upload necessary legal documents, educational materials, and invite people. Afterwards, an invited person can access their dashboard and manage any studies they have previously consented for, and they can drop out of them, or they can also accept any incoming invitations. And in the end, the researcher can actually see who has consented for what, and as you can see, it's completely anonymized if you're using our API service. So at the center of it is a blockchain technology. We are using Exanom blockchain, which stores the log of all of the consent actions. So we have a complete picture of what was done by which patient, and it's also distributed geographically. So meaning that we have multiple servers holding the same information. And using special algorithms, we can actually tell which node has been corrupted. So for example, some hackers attacking it, or there has been a fault. So the data is always secure. So where is it actually being used? So currently we are participating in a COVID-19 study in Middle East, and the time is of the essence in that study. So what we're doing is helping the nurses onboard patients for the study faster without the cumbersome paper format. And another study is being held here in Latvia using the Screeningslv platform, which is a breast cancer pre-screening platform where you can fill in the survey. You can go there right now if you want. And it helps quantify the risks of a population with breast cancer. So what we are doing is gathering consent for prospective studies, possibly inviting people to participate in them later. And so finally, it's just one piece of a whole puzzle. So actually, we have also other products that will work in conjunction with Themis, but my colleagues will tell you all about it later. Thank you.
Thank you. We have time also for one question. So in case you have any questions, please ask them. I have one question, if possible. Have you tested the user experience of your platform for the people who are using it?
Yeah, so what we are currently doing is participating in that Middle Eastern study. So we are working closely with labs, with people who are going to actually use it. And so far, the feedback was positive in terms of the administration panel. We still have not rolled out our patient-facing interface currently. It's only in the form of Screeningslv, where you can actually give your consent. But yeah, it's coming.
And knowing that you are really helping out with finding results for this COVID stuff. So what is your prognosis when we are getting something really usable?
Out of that specific study or in general?
In general, when we can finally live freely again.
Yeah, well, if I might have a small prognosis, I think that the vaccine might be ready by the end of the year, but it might have problems with distribution. So that's the main problem currently.
All right. You've heard it first here.